So the LDLs, which have come from the VLDLs being hydrolyzed by the lipoprotein lipase, what are they used for? Well, so LDLs, they make up 60 to 70% of cholesterol in the body, and it's transported in the LDLs, and it's used in membranes. Cholesterol is used in bile acids, and cholesterol is also used for making steroid hormones. And the normal level of lipoproteins in the blood, LDLs, should be around 3 millimoles per litre, so under 3, and HDLs should be greater than 1.2 millimoles per litre, because HDLs are better than LDLs, to make a total of around 5 millimoles per litre, and that's the normal lipoprotein levels in the body. However, one thing to note here is that these numbers, they vary between people, and they might be much too high for an individual but fine for others. Dyslipidemia is an imbalance of these levels, so it's either too much LDLs or too little HDLs. So let's see what can cause this. Well, increased LDLs, which, remember, they're cholesterol esters, that can cause dyslipidemia, and decreased HDLs can also cause dyslipidemia. And to deal with the increased LDLs, there's certain drugs that you can use, and to deal with the decreased HDLs, you can use exercise, or moderate levels of alcohol will increase the levels of HDL. However, there's no current recommendation if HDL is too low. Hyperlipidemia is too much lipid in the blood, and there's two types basically. You've got primary hyperlipidemia and secondary hyperlipidemia. Now, primary is genetic, and it can either be type 11A or 11B, 2A and 2B even. And secondary hyperlipidemia has metabolic causes. So looking at primary hyperlipidemia first, it's genetic. Primary hyperlipidemia type 2A will cause increased LDLs, which is cholesterol esters. And LDLs, remember, they're formed from VLDLs being hydrolyzed by lipoprotein lipase to form LDLs. And primary hyperlipidemia can also be type 2B, and type 2B is an increase in LDLs, but also an increase in VLDLs. And what's different about VLDLs is that they also contain triglycerides, as well as cholesterol esters. And type 2A as well as type 2B will cause our primary hyperlipidemias, which will result in, as I mentioned at the start, a higher risk of atheroma. So as you can see here, primary hyperlipidemia is genetic and can be type 2A or 2B. As I mentioned, secondary hyperlipidemia has metabolic causes, such as diabetes and hypothyroidism. So diabetes, hypothyroidism, renal disease, and alcoholism, these are metabolic disorders causing secondary hyperlipidemia. Now, hypothyroidism, remember, thyroid hormone is a metabolic hormone, so if you have a lot of thyroid hormone, it's going to increase your metabolism. So if you have less thyroid hormone, it's going to decrease your metabolism. So it's going to increase the level of lipids in your body. Now, if you remember back to the production of cholesterol in the liver, you'll remember that acyl-CoA in the liver, in the hepatocytes, is converted to cholesterol in the liver by an enzyme called HMG-CoA reductase. So to deal with hyperlipidemias and reduce the level of LDLs in the body, you can use statins, which are inhibitors of HMG-CoA reductase. So let's see what happens. Well, if you use a statin, then it inhibits HMG-CoA reductase. So you'll get decreased cholesterol synthesis in the hepatocytes from the acyl-CoA to cholesterol. If you inhibit the enzyme, you're going to get less cholesterol synthesis. So what does this do? Well, if you decrease the cholesterol synthesis, then the body recognizes that there's less cholesterol in the body, so it wants to increase the cholesterol in the body. And the way it does that is by increasing the transcription of HMG-CoA reductase. So essentially it's like a negative feedback. Essentially, you've inhibited HMG-CoA reductase to reduce the cholesterol, but this has been recognized by the body, and it results in increased transcription of HMG-CoA reductase. And therefore, it's going to result in a slight increase in cholesterol synthesis. So this is like the side effect of using statins. You're going to get a slight increase in cholesterol synthesis. So why do we use statins? Well, when you decrease the cholesterol synthesis in the hepatocytes, what it also results in is increased LDL receptors. Because remember, LDL carries cholesterol. So if you're decreasing the cholesterol in the body, the tissues want to take up more cholesterol. They want more cholesterol because they're losing it. So you're going to get an increased presentation of LDL receptors. So therefore, the LDL will be taken up by the liver and muscle tissues, and you'll get decreased LDL in the blood by 35%. And however, this will also result in some side effects. In the liver, you'll get hepatitis, because if the liver is taking up LDLs, then you'll get steatohepatitis, which means the liver will be full of fat because it's being taken up. And the muscles will become tender and inflamed, which is called myositis. So overall, if we look at it, you can to reduce the level of LDLs in the body and treat the hyperlipidemia, you can use a HMG-CoA reductase inhibitor, such as called a statin. And statins inhibit this enzyme, causing slight cholesterol increase due to this negative feedback mechanism, but reduced LDLs because of the increased LDL receptors, which can cause, as a side effect, hepatitis or muscle tenderness. And if we just look at some of the examples of the statins that are used clinically, you've got pravastatin and simvastatin. Now the difference between simvastatin and pravastatin is that pravastatin is a statin, whereas simvastatin is a prodrug. So it needs to be activated once it's inside the body to form a statin. Now the benefit of using statins is that you'll get, as I said, a decreased LDLs by 35%, and this will result in 42% heart disease decrease. And another thing to note is that another benefit is that there's no increase in triglycerides. And the reason there's no increase in triglycerides is because of the liver. The liver is taking up LDLs, and so the liver does not need to package more triglycerides with cholesterol to form those the VLDL. So there's no increase in triglycerides.